We looked at Crohn's disease in children. We looked at 137 patients, treatment naive patients at presentation, and 166 controls. The first question we asked ourselves is, do microgranulomas carry the same weight as granulomas? Are they sufficient to support a diagnosis of Crohn's disease? And the answer was a resounding yes. Now, this is a epithelioid cell granuloma without necrosis, no question at all, fairly large, composed of organized epithelioid histiocytes with very few intervening cells other than histiocytes. So in this study, this is what we defined as microgranulomas, 4 and 9 epithelioid histiocytes, lymphocytes, absolutely no eosinophils and no mucin and no neutrophils either. Clearly smaller, way smaller than the classic epithelioid cell granulomas, and also less well defined. One of the major conclusions of this study is that microgranulomas are often overlooked. We had as many as 20 cases in which no granulomas or microgranulomas were identified by the original pathologist, that on review we identified microgranulomas. In fact, there were 7 granulomas, relatively smaller granulomas, that were missed as well. So microgranulomas are certainly overlooked. We know from a prior study from our group that granulomas predict more aggressive disease, and the need for anti-TNF escalation in pediatric Crohn's. Found in that study is that microgranulomas carry the same implications as granulomas. Lymphocytic esophagitis was found in 20 patients, and just as granulomas, we found, and this is novel data, not previously reported, we found that lymphocytic esophagitis also predicts more aggressive disease. And unlike previous studies, we found that focal enhancing gastritis is relatively uncommon, about 10%, but over half the cases had diffuse. And unlike previous studies, we found that gastritis, non H. pylori related diffuse gastritis. So, focal enhancing gastritis is somewhat of a myth. What is far more common in pediatric Crohn's disease is diffuse non H. pylori gastritis, as seen here. Active ileitis was identified in about 50% of cases, but chronic ileitis was extremely uncommon at presentation. So, not surprisingly, chronic ileitis, as shown in this picture, was extremely uncommon. In fact, chronic colitis was almost as uncommon. So, chronicity in the lower GI tract is very uncommon in pediatric Crohn's disease at presentation. This is a heat map demonstrating activity in the ileum and the colon, and not surprisingly, much of the activity is either in the ileum or the proximal colon. Rectum seems relatively spared, and this is something that we have known for a very long time. This is a heat map of chronicity. Each column is a patient, and as you can see, chronicity is very uncommon, but when you see it in multiple biopsies in a patient. So here are the conclusions of the study. Microgranulomas are often overlooked. Microgranulomas have predictive significance. Lymphocytic esophagitis also has predictive value. What did I learn from the study? One, not to overlook microgranulomas, and two, to rely significantly on lymphocytic esophagitis, a combination of lymphocytic esophagitis and diffuse gastritis, for a diagnosis of Crohn's disease, since chronicity in the terminal ileum and colon are extremely uncommon.